Senator Costello, earlier you said when we discussed the provisions in the bill dealing with civil rights changes on whether or not we're going to support medically necessary procedures for transgender Iowans, I'm going to paraphrase you now, but you basically suggested that taxpayers shouldn't have to pay for those services because they're too expensive or they're expensive or that somehow. I wondered if you would yield and maybe clarify your view on that. I know Senator Walz asked a little bit about it, but I just want to be clear about your view on that.
Senator Costello, will you yield?
Yes.
Thank you, Senator Costello. Senator Costello, earlier, as I said, we were talking about what criteria you would have on whether or not transgender Iowans who have medically necessary surgical procedures, you were concerned about the cost of those. Could you elaborate more about why that concerns you?
Well, we have limited benefits for, there's certain things we do cover, certain things we don't cover. And I'm just pointing out that this is a rather costly procedure that would have to be a factor we consider in whether we want to do this.
Do you think that that people that need organ transplants that I assume are really expensive, that we should decide on whether or not we're going to support people that need organ transplants under the Medicaid program and have a cost test on that? Do you think that would be appropriate?
I don't know what you're getting at. I guess if the transplant was appropriate and available, I think we should do it.
And if it costs a lot of money, that wouldn't bother you because I think they're pretty expensive. I would guess that they're more expensive than some of these kind of more minor surgical procedures that a transgendered Iowan might want to have.
Certainly we want to try and help people with the needs they have. Joe, I do not think it's that most taxpayers want to pay for this type of surgery, which you would argue is not elective. Many people would think it was elective.
Right. And how about people with brain injuries that need rehabilitation? Is that something that you'd be okay paying for?
Yes.
And it costs a lot of money for senior citizens on Medicaid in our nursing homes. That's okay? You're okay with that, even though it's probably expensive? It's expensive. One of the more expensive things.
$23.5 million toward that.
Thank you, Senator Costello. So the Medicaid program pays for all sorts of things. Some are expensive, really expensive, and some are not. And we just heard Senator Costello describe kind of things that he apparently believes that Iowans think are okay to pay for. And then medically necessary procedure, maybe a transgender Iowan might need, but people kind of don't like paying for that. So we need this language in the bill. So I'm concerned about that. I think that strikes at kind of unequal service to the people of Iowa that have medical needs. So there are many reasons to vote against this afternoon, the least of which was a